So let us look at naproxen in this video. Naproxen comes like this tablet. So basically naproxen is an NSAID. What is NSAID? Non-steroidal anti-inflammatory drug. That is, it will reduce inflammation. It is anti-inflammatory. It will reduce inflammation. That is what you have to note here. And it is non-steroidal. That means it is not having steroids. It's not like those opioid analgesics, right? So it is non-steroidal. So this is anti-inflammatory. So where is naproxen? Here. It is coming with ibuprofen. So ibuprofen. So all of these have this pro word in them. Naproxen, ibuprofen, pro. What is pro? Propionic acid derivative. It is coming from propionic. It has some propionic acid derivative. It is a propionic acid derivative. What am I saying? Okay. It is a non-selective COX inhibitor. That is COX1, COX2 both looks like. Okay, so it is not selecting which COX, it is inhibiting all the COX. And it is coming under NSAID. Okay, it also will have a little pain reducing property and a little antipyretic effect also. Okay, it is coming under this group. Now, did you understand this much, people? What naproxen is? NSAID, anti-inflammatory. Very good. So basically this one, they are saying you can give twice a day or thrice a day. 250 mg is what they are saying. And what and all can you give it for? Mainly they are saying anti-inflammatory. It works very well like gout, rheumatoid arthritis, ankylosing spondylitis. Okay, so any inflammation, right? They are telling it is very well tolerated. Okay, so mainly for joint, touch your joint and say naproxen. Okay, and whatever they're saying, it carries a lower thrombotic risk than diclofenac, etc. So so what else? That is all. If you know, it is enough. Now you just tell me main points. Naproxen is what? NSAID, and it is anti-inflammatory, and it is similar to ibuprofen in the classification, and it is mainly used for treating inflammation like in acute gout, rheumatoid arthritis, ankylosing spondylitis, etc. And it can have a thrombotic risk. You should reduce the dose in elderly. These are very specific to naproxen. Okay. Otherwise, NSAID means what and all you should know. So anyways, let us look at the NSAID side effects. So remember that it can cause so much of gastritis, right? Gastric irritation. So it can cause erosions in the stomach wall, ulcerations it can cause. Okay. So you need to remember that it causes sodium retention. So sodium retention will lead to what? Water retention. So that can lead to edema, and it can lead to rise in blood pressure because it is retaining water. So what is trying to do? NSAID was trying to reduce inflammation, but it increased the water levels in your body because sodium level, so water retention. So inflammation is going down, but water is getting retained, remember. Now, you can write everything else. Let's look at the common ones here. It can cause headache, okay. It can cause some, one second. Okay, where was I? So here. So it will cause thrombocytopenia, that is low platelet count, can lead to bleeding, right? So that's what you remember. And it will cause exacerbation of asthma. Asthma will can become more, okay? Asthma attack can become more. Now it can cause angioedema. Angioedema means blood vessels will leak fluid. Again, the same thing. Water, edema. Okay, something like this. Angioedema. Anywhere it can be. Okay. So these are all very different, isn't it? So that you have to remember. Otherwise, for all drugs, what do we write? Nausea, headache, hypersensitivity. That is skin rash we have written here, right? Standard things that we write with all drugs, you already know, right? But here, what you should write, peptic ulceration, erosions, peptic ulcerations, right? Then edema, very important. Then rise in blood pressure, right? Then thrombocytopenia, bleeding tendency, right? Then and asthma exacerbation. This much you have to write, okay?